Coronavirus has devastated the global economy and killed more than 270,000 people as it spread exponentially. As conversations shift towards reopening the country and getting people back to work, proper sanitation in high traffic and public spaces will be key to getting back to normal. In places like China, robots and drones are being used to spray disinfectant in public spaces. Airlines and companies like Amazon have been using fogging as a sanitation technique to keep their facilities clean. But there is another option. UV light is an effective disinfectant that has been used for decades in hospitals and operating rooms. The global UV disinfection equipment market was valued at $1.1 billion in 2018 and is projected to reach $3.4 billion by 2026. It can help prevent the spread of the virus, and technological breakthroughs could see UV light become a key piece in returning to normal in a world with a looming COVID-19 threat. Ultraviolet light was discovered more than 200 years ago. It was first used for disinfecting surfaces in 1877, for water in 1910, and for air in 1935.
It was discovered because of its antimicrobial, antibacterial properties. And actually in healthcare became pretty widely adopted in an effort to try to disinfect the air and ensure that people who were in that environment were not getting exposed to tuberculosis.
UVC has been known for more than 100 years now to be really, really good at killing microbes, bacteria and viruses both.
Ultraviolet light is part of the electromagnetic spectrum, which includes things like gamma rays, X-rays, infrared light, microwaves, visible light, and radio waves. Ultraviolet light is grouped into 3 categories based on the light's wavelength. There's ultraviolet A, ultraviolet B, and ultraviolet C. The sun produces all 3 types of UV radiation, but we only experience A and B on Earth's surface. Within the spectrum of ultraviolet light, UVC, which sits at 200 to 280 nanometers, is in the germicidal disinfecting range.
What we experience as sunlight here on Earth is mainly UVA and a little bit of UVB. And they are actually much less efficient at killing microbes than UVC. UVC is by far the more efficient way of killing microbes.
We know that ultraviolet light is effective against many different kinds of viruses, many types of bacteria, and even some very hardy bacteria that can produce spores with thick coatings on them. Ultraviolet light can be effective against those and effective against fungus also.
UVC light can be quite dangerous. It can burn exposed skin and damage your retina. The World Health Organization issued guidance not to use UV lamps to sterilize hands or other parts of the skin.
The issue with UVC, though, is that it's a health hazard. So you can really only use it when people are not around.
UVC light interferes with and destroys the nucleic acids, the DNA or RNA of bacteria, viruses, and other microbes.
What it does is it causes chemical bonds that aren't supposed to be there to form within the genes of the microbe. And those new chemical bonds prevent the microbe from replicating. And because the microbe can't replicate any longer, it effectively kills it off.
Ultraviolet light can kill microbes in many different environments. It has been used for several decades to disinfect drinking water, wastewater, air, pharmaceutical products, and surfaces against a whole suite of human pathogens. Despite all of its uses, there are a few things that limit its effectiveness.
If there is organic material, so if there's essentially dirt on a surface, the dirt impacts how much of that ultraviolet C light is able to get to the microbes. And because of that, it works best if the surfaces are cleaned first, effective against the coronavirus family, and there's structural similarities between all of the viruses in the coronavirus family. Everybody expects that ultraviolet C light will be very effective against the SARS-CoV-2 virus.
UVC light has been increasingly used in healthcare environments to prevent infections in hospitals.
As we started to see more drug-resistant bacteria and drug-resistant fungus, there's really a growing interest in the use of ultraviolet C light to help disinfect our healthcare environments.
UV light is efficient as a disinfectant tool, and it just needs electricity to work. It's faster and less labor-intensive than cleaning by hand. It also reduces the need to clean with powerful chemicals.
You could just use more bland soaps for the cleaning and then rely on UVC for a chemical-free disinfection.
Cleaning staff can also miss areas.
There was a number of studies that came out in the early 2000s showing that housekeepers, and they do an incredible job, they would miss about half of the high-touch surfaces.
Ultraviolet light could be a powerful tool in the fight against COVID-19, and in some instances it's already being used. China is disinfecting entire buses with UV light, and banks are using UVC on currency. The Pittsburgh International Airport became the first airport in the US to deploy autonomous cleaning robots equipped with ultraviolet lights for disinfection. Daimler has a device designed specifically to disinfect planes called the Germ Falcon. It's the size of a drink cart and has articulating arms that extend over the plane's seats. But one of the biggest challenges we face is how to keep public, high-traffic areas clean.
As we get back to work in the next few months, and we'll be in rooms and much closer to each other than we were before, there's the concern again about transmission of viruses from one person to another.
COVID has really brought the importance of disinfection home to almost everybody all over the world.